All right. Welcome to the COVID management uh, workshop that we are doing right now. And this workshop is going to be a free workshop that everybody can attend. We are going to be talking about most of the things which are going to be myths that are involved during the treatment and the management of COVID. We are also going to talk about how, as we caregivers, can be assisting other people and saving more lives instead of doing more damage. This entire session is brought to you by Into Canada Educational Services, where we are going to be training physiotherapists across the world and we will be helping them to get their licensing in Canada. When we talk about COVID, this is something which we never heard about before, and there was something that we wanted to understand or know even during our 2003 2014 when there was a SARS epidemic. COVID was never a big amount of discussion. What we have found out here is that in 2019, it was just a paragraph in our textbooks. This includes medical textbooks. It could include our talks about discussions about COVID or coronavirus. It would be just a small paragraph in a newspaper or in our textbooks. And it was thought of as a disease which would be in a foreign country. But it was connected with SARS. In 2020, we saw this epidemic turning into a pandemic, and it affected countries, cities, and localities that we knew of. In 2021, it has become a full blown pandemic, and that has come to our house. We have people whom we know are affected, people with families who are affected with that, and it has gone out of control. What I'm going to be trying to do over here today is not to work upon what is COVID or giving you information about COVID. What we are trying to do is to spread proper documented knowledge about this entire concept of COVID. And in this, we are going to be referring to the World Health Organization documents, which are published online. And we have taken all of these things from there itself. Coming to our COVID 19, it is a coronavirus is an infectious disease which is caused by a newly discovered coronavirus. Most people infected with this will experience mild to moderate respiratory illness and they will recover without requiring special treatment. Older people and those people who have underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to be having more serious illnesses. However, these days we also find that there are younger people who are getting affected by it. And how do we work upon the prevention? We will talk about it in a few slides. The best way to prevent and slow down the transmission is to be well informed about the COVID 19 virus, the disease it causes, and how it will spread. You will protect yourself and others from infection by washing your hands and using an alcohol based rub frequently and not touching your face. The COVID 19 virus spreads primarily through droplets of saliva and discharge from the nose when an infected person coughs or sneezes. So, it is important that you also practice respiratory etiquette. That means when you cough into the shoulder or into your elbow rather than doing it over a kerchief or doing it out in the open. The next thing that we want to understand here is how to keep yourself and others safe from COVID. So, the number one thing that everywhere in the world is being followed is maintaining a 1 meter distance between yourself and others to reduce the risk of infection. You maintain even greater distance between yourself and others when you're indoors because the air is circulating inside. The further away you are, the better you are. Making wearing a mask is a very normal part of your well-being around other people, and more than yourself you are protecting other people from getting infected in case you are a carrier. What is more important than wearing a mask is how to use it, how to store it, how to clean it or dispose it, because that is right now a very rampant problem that we are facing. And how do we do that? We will talk about it in the next slides. How do you wear a mask? So, before you wear a mask, you need to understand you need to clean your hands. And after you remove it, you also will need to clean the hands because the mask is like a shield, it's a barrier. It is protecting all the bacteria from coming into you. But if you are going to touch it, you are going to get infected with that. You will make sure that the mask is covering not only your nose, but also your mouth and your chin. And when you take it off, you can store it in a clean plastic bag. What we have seen very commonly over here is people hang it in the car, people hang it on the door, people put it in the pocket. Those things are going to only increase the bacteria or the virus which is there. And this is not only about COVID, but it is also about other bacteria and fungi which could be present in those masks. You will never use masks with valves because those valves, even if they trap the bacteria, they are going to be able to multiply that. For bacteria, virus, or fungus to multiply, it just requires two things: hot climate or warm climate, and moisture. When you're breathing, both of those things are happening. So you don't want to be keeping those things in a susceptible environment which is going to be more conducive for them to multiply. How do you make your environment safer? The three C's that they are talking about is closed environment, crowded environment, or any environment which has close contact. As of right now, we see rallies which are happening, we see award functions which are happening, we see a lot of medical functions which are happening, we see a lot of gatherings which are happening over the beaches, in marriages. Those are things which are going to be making that spread even go wider than this. And outbreaks have been reported in restaurants, choir practices, fitness classes, nightclubs. And in all of those areas, we are at a very high risk of getting infected. These environments are where the virus appears to be spreading by the respiratory droplets or by aerosols more efficiently. And so, taking precautions about this is even more important. When you have good hygiene, you will regularly and thoroughly clean your hands. You will avoid touching your eyes, nose, and mouth. A recent study said that on an average, a person within 1 hour will touch their eyes, nose, and mouth at least 30 times. And this thing, if you have already touched a surface which is having a virus, it can transmit right away. When you are going to be doing any cough or sneeze, you will try to cover your mouth with a bent elbow or a tissue paper, and then you will dispose that thing in a closed bin. Unfortunately, some of the bins that we have in Canada, in India, we have those things open. And when you're dumping it, you're just allowing more and more bacteria to dominate over there. So, cleaning the surfaces and disinfecting them are a very important aspect as well for coronavirus. If you are feeling unwell, that means you will need to understand first that you may not have COVID. The most common symptoms that you see are fever, dry cough, and tiredness. Other symptoms which are less common can be including taste or smell loss. It could be having aches and pains, headaches, sore throats, nasal congestions, red eyes, diarrhea, or a skin rash. If you have any of these symptoms, the best thing that you want to do is first isolate yourself from your near and dear ones. You isolate yourself, stay at home so that you don't spread it out in the public, neither to your family. And you will try to call your health provider. You can call up your local doctor, your GP, your any person who is in the health industry whom you trust, and you will talk to them about getting them advice. You will not get out and try to get supplies, medicines, or food. Try not to get out and try to infect other people. If you need to leave the house or have someone near you, you will wear a medical mask to avoid infecting other people. There are times where we are not able to do that thing. So we cannot be alone. We have children at a house, which we cannot leave them outside. So at those times, make sure that you are wearing a mask so that your transmission is restricted. If you have a fever or cough, you will seek medical attention, but you will also try to keep up to date upon the latest information from trusted sources. This entire workshop that we are doing or the lecture we are doing is taken from the World Health Organization. And these things are basically going to be best for advising on what should be doing for your best protection and for protection of the other people involved with us. Catching COVID does not mean you will have it for life. This is something that a lot of people believe in, that I have COVID now, so my life is over, I'll probably die. I will not be able to live my normal life. But the fact is, most of the people who catch COVID can recover and will eliminate the virus from their bodies. If you catch the disease, make sure that you are treating your symptoms. If you have cough, fever, and difficulty in breathing, you will seek medical help right away. And try to do that thing with supportive care you will come across. There are certain aspects, as everybody's body is made uniquely or differently, there is a very high chance that there may be some complications that arise. There can be respiratory problems, there could be very severe fatigue, lethargy that you may feel. When you have those things, try to search for a hospital and get yourself admitted. But again, make sure that you're taking assistance but without coming in contact with those people that are helping you out. There is one more very common WhatsApp which is roaming around, which is like a circle with lungs, and that shows that if you are able to hold your breath for 10 seconds, you will not have COVID or you will be free from COVID. The problem is being able to hold your breath for 10 seconds or more without coughing or feeling discomfort does not mean that you are free from COVID. The most common symptoms of COVID are dry cough, tiredness, and fever. Some of the people can develop more severe forms of this disease, like pneumonia. The best way to confirm is with a lab test. The RT-PCR tests that are available, you can go for those things, and you will not be able to confirm it by doing a breathing exercise, because in case you do have infection, that holding of breath is going to be even more dangerous for you. The next thing that we have seen quite commonly happening is people have bought a lot of ultraviolet lights from the market and try to disinfect the area. Ultraviolet lamps should not be used to disinfect hands or other areas of your skin. These will cause skin irritation and they will damage your eyes. So, cleaning your hands with the alcohol based hand rub or washing your hands with soap and water are the most effective ways of removing this virus. When you say alcohol, you will say alcohol based sanitizers can be used in the religions where alcohol is prohibited. When you talk about any manufactured substance which is developed to alleviate illnesses or contribute to a better health is permitted by the Quran, including alcohol used as a medical agent. And this thing comes from the World Health Organization. No religion, no religious book, no religious guru should ever be mentioning that taking these things as a precautionary measure should be not done. So I would strongly recommend that disinfecting ourselves and disinfecting the surfaces around us is a very essential part of trying to stop this spread. Nothing in life is to be feared, it is only to be understood. And now is a very right time to understand more so that we may fear less. More than the COVID pandemic, which is hitting a lot of people that we know of, it is more of the fear. There are WhatsApp messages which are circulated across us where they say you can get COVID with this, you can get cured with this, you can do this nuska, you can do this concept, and that will cure you. All the times that is not going to be possible. All the time it is not the ultimate truth. For finding out that truth, we will need to get into the basics. And those things are basic centers which are actually designed to give you proper, correct information. That is the World Health Organization or the CDC. Those are two places which I would probably want every one of you to go and check. If you have a myth that comes in front of you, you can probably go and check if that is the truth or if it is going to be a false thing. I'm going to talk about a few more things which are very, very commonly discussed these days, and we'll try to break those myths as well. One was people should not wear masks during exercises. Now, this is a fact. When you are going to be exercising, the mask will reduce your ability to breathe comfortably, and the sweat will make the mask become wet more quickly, which makes it even more difficult to breathe, and it will promote the growth of microorganisms. So, when you are doing exercises, the best way to do it is to maintain a physical distance of at least 1 meter from other people and then do your exercises. But do not wear a mask and do your exercise. The next thing that we see is the likeliness of shoes spreading COVID 19. I have seen videos on WhatsApp where the people are going inside the house and they are pouring bleach, they are pouring disinfectants over the shoes, over the whole body. It is a little bit more on the higher side of not to do things. The likelihood of COVID 19 by shoes is very low. As a precautionary measure, what you can take care of is where there are infants or small children which are crawling or playing on the floors, you can leave the shoes outside. This will prevent contact with dirt or any waste that could be carried with the soles of the shoes. But other than that, there is not much possibility of your shoes spreading the COVID. The prolonged use of medical masks. So, when medical masks are worn properly, they will not cause carbon dioxide intoxication or oxygen deficiency. This is a very common problem that people feel that, oh, I feel difficulty in breathing. Yes, it is a uncomfortable thing, but it will not lead to carbon dioxide poisoning, neither will it lead to oxygen deficiency. When you are going to wear it, make sure that it fits properly and it is tight enough to allow you to breathe normally. And do not reuse a disposable mask. And if you are using a cloth mask, make sure that you are washing it every single day or trying to change the mask every day and keeping the used mask into a washer cycle. Another common problem that I've seen happening here is the use of pepper, garlic, camphor, kada, all of those things. Adding pepper to your soup or other medications or any other meals will not prevent or cure COVID. Hot peppers will be very tasty, but they will not prevent or cure COVID. The best way to protect from coronavirus is 1 meter away and washing your hands frequently. There is nothing else that we need to actually do. For our general health, maintaining a balanced diet, staying well hydrated, and exercising regularly and sleeping well is our key things that we should be doing. Eating garlic also does not prevent COVID. It is a very healthy food that has some antimicrobial properties. But antimicrobial and antiviral are two different things. So, eating garlic has never protected anybody from getting COVID. Then we have something which is called as the palliative care. So, COVID ho gaya, we have COVID now. Now, what do we do? So, this is basically where palliative care comes into play, where we are going to have a host of people that are working with us: physicians, nurses, support workers, paramedics, pharmacists, physiotherapists, volunteers. All of those people are aiming over one thing, which is improving your quality of life after getting COVID. Those people are not into the money making business as most of you perceive. They are trying to help out. In that process, if they are even trying to make some money or they are trying to dupe you or they are trying to gain some benefit out of it, that is their karma. But our job at that particular time is to get out of this problem that we are facing or this infection that we are facing. Pain and difficulty in breathing are the two most common and most frequently associated symptoms that we have with palliative care. With AIDS, with cancer, people had these problems. Cardiovascular problems, 67% of the patients have these problems. So when we say COVID 19 is going to be the killer of the year, that is not the scenario. A lot of people have the similar problems with other diseases and disorders also. One of it would be the AIDS, cancer, or cardiovascular problems. Now, with this, patient harm is a very common thing that we have seen right now. So somebody's given them a wrong medication. Some pharmacist has sold a faulty medication or an expired medication to somebody. Some physiotherapist is doing chest physiotherapy, which is going to be creating more harm than getting cured. Those are aspects which we have to be very careful with. And unless it is coming from a source which is going to be certified by you, do not try to trust all of those things that are happening for us. To err is human. We all can make mistakes, and we are working in a very high complex thing, high stress environments. And unfortunately, 1 year before, we never knew something like this could happen. So, all the doctors, all the pharmacists, all the physiotherapists, all those caregivers, support workers, volunteers who are helping out, give them that benefit of doubt that they are actually trying to do something good for you. And when they are going to do that thing, we can only express gratitude. Our entire society is based upon the safety of the beliefs, values, and attitudes that we are going to work with in the workplace. Caregivers, they are also having a lot of fatigue, they also have a lot of stress, and they are always constantly in the fear that probably they can get COVID. And when they get COVID, they are right now helping out other people, but who will help them as well? So we have to be mindful about those concepts also. And when we are doing that thing, we are talking about something which we call it as quality of care. Quality of care is the degree to which the health services for an individual or populations increase the likelihood of desired health outcomes. And when this thing happens, we have multiple quality elements which have been described over the past decades. Now, we have very specific things that quality health service should be. One is by preventing or by providing evidence-based healthcare services for those in who need them. Evidence-based services means things which are already very well researched. When we talk to doctors in India, we talk to doctors in Middle East, we talk to doctors in Africa, they say, oh, we are going to give them doxycycline, we are going to give them Dolo, we are going to give them Fluvir, we are going to give them antibiotics, we are going to give them antifungals. It's a cocktail of medications which are not recognized anywhere else in the world. Is it bad? Probably no. Some people have benefited by it and they have been saved by their life. But some people will create a lot more complications. 2 days ago, World Health Organization came up with a whole concept which said steroids are not necessary for the treatment of COVID unless it is in a very, very acute stage. So we have to be very mindful of what we are getting as treatment as well. There were people who were stocking up a drug which was called as remdesivir, and they had 60,000, 50,000 vials kept by themselves. Now that thing is something which is unwanted for. If everybody could get access to it, it would have been a much more smoother thing. When the COVID pandemic started off in Canada, there were people who hoarded up tissue papers, thinking that it is going to be not available henceforth. But all of those people right now, even after years of, after 1.5 years of this passing of COVID, they still have tissue paper stock and tissue papers are freely available. So my aim over here on talking about this is that resources already are very scarce. We don't want to hoard them and try to keep them for ourselves, thinking that when we need it, we will not get it. Because if everybody keeps on thinking the same way, we will not be able to give it to the people who actually need it. Secondly, we want to reduce the waiting times which are there with the hospitals. So, as of right now, with healthcare in Northern America and in America, what we have seen is that even if you have a small cut in the hand, you will rush to the emergency room. You will rush to a doctor or a walk in clinic, which you could easily bandage it by yourself. That way, you are loading the system with unnecessary more pressure. And because of that, the people who actually would need help would be in the line. So my concept over here on talking about this is when we are going to be doing these concepts, when we are going to be trying to think, see if it is very, very essential, only then try to use up those resources. I have seen, or rather, I was dealing with a lot of people who were suffering from COVID in India, and I saw that people are just rushing to the hospital and standing in lines with or without COVID just to get admitted. अगर हो गया तो हम safe रहेंगे. That is not how we should be. And again, I am not preaching about how things are in India or how things are in Canada. This is a very general thing that I have worked over people and physios from all across the world. So we are getting information about all of these areas. And what we are trying to understand is that no matter what the geographic location is, no matter what the race is, what the ethnicity is, people are trying to understand or trying to grab all the resources available, which is going to make it even more scarce. What to do and what not to do. So, here we are talking about wearing a mask, which is the basics of human hygiene as of right now. Regularly and thoroughly clean your hands with an alcohol based hand rub and avoid touching your eyes, nose, and mouth. If possible, as of right now, till the whole COVID situation is under control and all of us are getting vaccinated, avoid getting out, avoid getting too much into public places, and avoid the spread of this entire disease. Cover your mouth and nose with a bent elbow or a tissue when you cough or sneeze. You will clean and disinfect the surfaces which you frequently use, like door handles, faucets, taps, phone screens. And if you are going to be feeling unwell, then remember about all of these symptoms of COVID. The most common symptoms are only three: fever, dry cough, and tiredness. The other symptoms could be loss of taste and smell, aches and pains, headaches, sore throat, nasal congestion, red eyes, diarrhea, or a skin rash. If you get these things, again, first try to treat yourself conservatively. And if only if your symptoms are getting worsened, then you will go and get admitted to a hospital. Number one thing that we want to work upon is stay home and stay safe. If we have any kind of fever, cough, or difficulty breathing, we will seek medical attention immediately. And then we will also talk about only things which have information from trusted sources like the World Health Organization or your local and national health authorities. The units which are going to be designed for helping out these people in different provinces, in states, in cities, in towns, in talukas, please get information about that. And the one more thing which I have seen very rampantly happening is that the spread of resources. So right now oxygen cylinders and oxygen concentrators are a very rare commodity these days. So what happens is, let's suppose I find out that okay, this person is having 10 oxygen concentrators. I will WhatsApp my entire family, friends, relatives, about 300, 400 people that this person has this. Now, with the panic that is already there in the crowd, people will go and purchase that or rent it out. And that will mean that you, when you actually need the resources, you will not have it. So the resources are not going to be ending. Yes, it is very difficult these days to get things because there are a lot of people who are hoarding stuff, who are keeping stuff for themselves. So if we are having it openly available and we are trying to help out people, it will be a very easy and a fast way to get these things done. When we talk about clinical evaluation of patients, this is basically for people who are already having COVID or people who are having family or friends who are going to be suffering from COVID. These are the talks that we are going to talk about on how to work on the evaluation of patients. When we talk about these concepts, we have very simple things that we can work upon. So the first one would be the evaluation of the home settings. That means, can you carry out hand and respiratory hygiene? Can you get the environment cleaned? Ventilation, limitations, or movements around the house. I know a lot of people don't have palatial or big mansions or five, six rooms that they can keep a person isolated. But one room has to be dedicated for those people. When you have presence of vulnerable people, that is people who have had a pre-existing condition, a cardiac issue, a neurological issue, somebody who has, let's suppose, AIDS, or somebody who has a low immune system, those people, or even people with older age, they are very vulnerable. So your job is right now to protect those people first. Your ability of a caregiver to provide this care should be at least once per day and recognize the signs and symptoms of any worsening of the health status. You don't need to be a doctor or a nurse to find out if this person's problems are aggravating. Availability of trained health workers to support the patient and caregiver is possible, but that is available either on a phone call. These days, we have social media, we have video calls, WhatsApp calls, Zoom meetings that we can do and consult people online instead of getting them into the house. The more we are isolated these days, the more we will be able to be together in the future. The next thing is, if adequate isolation is not ensured, then we will isolate in designated community facilities. I can speak for Canada and for India. Both of those places have done an amazing job where they have more and more designated isolation facilities which are developed, be it in Delhi, be it in Mumbai, be it in Chennai, be it in Hyderabad, be it in Canada. Everywhere they have these isolated facilities which they have produced or organized for, and these are done by volunteers and by medical professionals also. You will try to get them into those facilities if isolation is not possible at home. And along with this, there are other problems that could be there. Right now, it's the advent of monsoon in India. It is the advent of spring and summer in Canada. We have so many times where we will find ourselves infected with other infections, influenza, malaria, dengue. At those times, we don't want to overcrowd the hospitals with these things. Instead of that, seek medical help, get the routine protocols, and then work upon their signs and symptoms instead of going into the panic mode. When we do a risk assessment, we will see if we have the medical mask, eye protection, gloves, gowns while caring for the patient. If it is inevitable that the person is going to be at home, then these are things that you should be very careful with. You will ensure that the room is well ventilated. There are windows in the room and they can be opened up, keeping fresh air in the room. The more the room is closed, the more the bacteria and viruses can multiply in there. Provide instructions to the caregivers that not everybody needs to be entering the house or the place that the person with COVID is and using disinfection entirely in the room. Keep the laundry separate, keep the waste separate, keep the utensils separate. It will only help you prevent that entire infection spread. Request the limiting of the house members during the visits and maintaining at least 1 meter distance. This is a very common thing that I've seen even in here as well as in India, which is that if there is a person with COVID, there will be 10 relatives who will come over and try to visit them. That is something which is not needed right now. If you want to do a social visit, give them a call, do a video call, and be with them. Give them emotional support. But a physical support at this time is going to be deadly. When you are going to be meeting people, when you are going to be going out, make sure that the PPE or the mask that you are wearing is disposed of in the right way. Also, make sure that the waste generated by the care of the patient is put up in a closed, secure bag, and either it is burnt or you will dispose it where infectious waste is going to go, not just outside in the kachra ka dabba. Because when you put it over there, that infection can spread to another thousand different people who are going to be throwing that same garbage into that place. The second thing is all those small areas which we miss out generally, which is tables, bed frames, bedroom furnitures, taps, handles of the doors, those should be cleaned normally. Most of the people will have a single or a shared bathroom that they will be sharing with the patient. So make sure that the patient himself can sanitize that area, the bathroom surfaces, the toilet surfaces, the handles, all of those things are disinfected by them once they use it. And regular household soap and detergent can be used for cleaning. You do not need high intensity bleach or you do not need any kind of chemicals to clean that thing. A regular soap or a detergent can be used. For physios, there is one important aspect which is doing the rounds these days is faulty physiotherapy. In an acute condition of COVID, please do not go ahead and give them chest mobilizations, tapping them, hitting them on the chest and the back. That only helps in spreading the infection more and it does not help you in any way. Initially, because you are going to do a percussion or a mobilization for these people, they may feel that the oxygen level is going high or they are getting better with the breathing, but that is going to only go down in a very drastic manner once it is going to be stopped. So please make sure that you are taking that thing into consideration and using only protocols which are mentioned by the World Health Organization to do COVID management. There are a lot of good workshops which are happening these days on how to take care of respiratory symptoms, how to work upon mild stages, moderate stages, and oxygen supportive measures also. Please make sure that you are understanding those concepts and then giving out chest physiotherapy. Some people or some patients that you are going to work with, they may also go in for acute respiratory distress syndrome or non-invasive ventilation that can be done for these people. Those people, the best way to work with them on the ventilation, and this is something that everybody, even non-physios, can work on. If you are feeling difficulty in breathing, the best way to work upon is lie down with your face down towards the floor. That means prone position. This is going to help you in increasing your breathing capacity. During the acute phase of COVID, the researcher, whose name is Lazari, he says that any interventions could potentially increase the risk of breathing that are contraindicated and should be avoided. Once the person is stable and no longer in the ventilator or on an oxygen tube, if indicated, the main role in physiotherapy will be to mobilize the secretions and ease the work of breathing. Interventions can increase techniques like positioning, autogenic drainage, deep breathing exercises, breath stacking, active cycle of breathing, or manual therapy techniques like percussion, vibrations, and cuffing. These interventions can be performed at any stage of the disease where appropriate and are safe to perform. This safety is at our discretion. So make sure that you are not getting contaminated, you are not getting infected, and whatever you are doing is for the benefit of the patient rather than putting it out on social media and trying to gain more credit on that. Positioning is a very vital thing, and everybody should just lie down flat on the floor or on the bed with their face downwards. That is going to be the most better way for improving the breathing. There are certain times where you are not able to lie down prone or on your stomach. That time you can also go on the side lying position, and that will also be helping you to reduce the load of breathing. Nebulization is another common thing that I have seen in the last couple of messages and videos that are being circulated. That nebulization is almost also like oxygen therapy. Please try and understand, nebulization does not provide oxygen at all. It has a solution, a saline solution, which is broken down into a aerosol technique, and that is infused inside the lungs, which makes the secretions a little bit looser. And these nebulizations, if they are given with other medications, they will help in the person to administer the lungs with more medications, but it does not have any oxygen capacities. Oxygen is required and deemed essential. Please make sure you are meeting with the guidelines of the doctors or the nurses who are at your service or at your disposal. But do not try to give them nebulizers and try to stock them up from local chemists and try to give it to COVID patients thinking that that is also oxygen therapy. The most commonly practiced things that people do in the early stages of COVID 19 and respiratory distress care is advised when planning a treatment program. Common modalities often used by respiratory therapists are contraindicated. And this means in this particular scenario of COVID, where the person is in the hospital or in their house and you are wanting to give them therapy, these things should not be done. Diaphragmatic breathing should not be done. Pursed lip breathing should not be done. Bronchial hygiene, lung re-expansion, PEP bottles, easy PAPs, cuff machines should not be given. Incentive spirometry is a killer. So please try and not give them incentive spirometry. Manual mobilization techniques or stretching of the rib cage is contraindicated. Nasal washings or doing jal neti is not indicated. Respiratory muscle trainings in an acute phase is going to kill the person. Exercise training is not required at that particular time. Patient mobilization during the clinical instability is not required. So please try and understand that all these techniques are very good when we are doing it in respiratory physiotherapy, but that is not COVID. In COVID, it's a totally different ball game, and all of these things will create lot of issues and lot of problems for the patient rather than helping them out. So if you are seeing anybody who's doing this or who is performing it, you have the full liberty to show them this slide or take them to the World Health Organization website and show them what is mentioned out as not to do. Please make sure that this is done for the public interest. In the weaning phase, if the patient is awake, cooperative, and in the weaning phase, then you can do active cycle of breathing, lung volume recruitments, so on and so forth. And manual techniques, there is a controversy right now with this. There is no evidence for percussion. So, all those videos that you have seen with people beating the chest and beating the back behind, that is not working. There is some evidence for expiratory vibrations to mobilize secretions, but in COVID particularly, it is not going to be safe or it is not going to be useful for us. So there will be a problem if they are going to be using those things with adequate PPE use. In the rehab phase, which is when the person is in the intensive care unit, passive active assisted active movements or resisted joint movements can be given to them. Mobilizations, rehabilitations can be done, prevention of complications can be done, and we do play, as physiotherapists, we do play a key role in prevention of these complications. But ventilator associated pneumonias, secondary infections, contractures, and pressure area sores are what we should be focusing upon rather than going in for these acute high funda treatments that we are trying to do for patients. We have the best interest of the patient in mind, but in this bargain, because of our lack of knowledge, we will end up damaging them rather than getting them more better. Another thing that we want to do, and this is for everybody who's practicing COVID care. This could be a person who's a shop owner, it could be a person who's in the house, people who are not working, people who are working, anybody and everybody. There are certain things in life which cause us a lot of trauma. Everybody in the world right now who has access to social media, who has access to people, will be knowing about COVID. It is one of the most widespread word used these days. For coming out of these things, there are so many things that the government has done. And then there are certain things which the government should do, but we are not doing it right now. So we will talk about things which we have in hand. Why not do a self care bingo? We will take photographs. We can go out for a walk, maintaining social distance. Meditation is free at home. There are so many apps, there are so many videos. On YouTube, you can find so many places where you can actually submerge yourself into meditation. Make some nice tea. Make something that you like. Make a blanket fort with kids if you have kids at home. If you want to have people around safely, you can create that environment which is a happy environment. Help somebody. Went to a park. Turned off devices. There is something which we practice which is called as the Earth Day. On that day, from 8 o'clock to 9 o'clock, we shut off our mobile phones and all the equipments in the house. That thing we can practice it probably every week once. Listen to music, read a book, exercise, phone somebody. When was the last time you actually picked up the phone and tried to talk to people that you have not talked to in the last 5 years? It is very easy these days because we have a lot of time at hand. Most of us are in lockdowns. So make sure that you pick up the phone and talk to people. Have fun. Play a board game with people. There are Zoom meetings that these days which are happening, which have Housey, Lotto, Bingo that can be played. Get stuff done. Things which you have been waiting for. That closet that you have never cleaned up in the last 5 years. Use that time. That dresses that you have kept on for so long. Use this time to get rid of them. Learn something new. There are so many online lectures, online workshops, online info sessions which are happening. I'm very happy and very glad that all of you people who are listening to me right now are trying to learn something new. Probably you may know 80% of the things that I may have talked about right now. But if I could make a difference to one person, I would be happy that I did this. Take a nap, dance, get out in nature, eat a healthy meal, get off social media, journal, try to document what you're doing in these days, laugh and clean something. These are things which government of BC, of course, in British Columbia, Canada has given us that we can play a self-care bingo. Did we do these things? And if not, it gives us a food for thought that we can go ahead and do these things in a better way. When we want to help to stop COVID, get a COVID 19 vaccine. Right now, vaccines are available. There is Pfizer, there is Moderna, there is AstraZeneca, there is Covishield, there is Covaxin, so on and so forth. Please make sure get yourself vaccinated. The reason is it will not prevent you from getting coronavirus. It will prevent you from getting complications of coronavirus. You have all taken in the childhood, you have taken flu shots, measles shots, rubella shots, TB shots. It does not mean that you will not get it in the future. It means that in case you do get that problem, it will not be as serious. So, vaccination is a very important aspect of our life these days. Wash your hands often. Cover your mouth and nose with a mask. Avoid crowds and practice social distancing. Donate blood and plasma wherever possible. The number one thing that I would want everybody to do is report fraudulent COVID 19 tests, vaccines, and treatments which are floating around in the market. If you find something which you feel is not appropriate, it's a myth, go and check that source. We have time right now. So go and check that source. If you find that this is in PK's language, in an Indian movie, PK, we say it's a wrong number. If you find that it is a wrong number, go ahead and just report that thing out. It will save somebody's life probably. Ultimately, what I would want to say is this too shall pass. We have gone through a lot of things. COVID 19 is a pandemic that we have gotten this uh, decade or this century. Every century for the last 400, 500 years, we have had a pandemic that has hit us. It was the Spanish flu, it was the SARS problem, it was the bubonic plague, so on and so forth. We have survived all of that. And as humanity and as your human race, we will survive this too. And we shall overcome. I wish you guys to stay safe, stay well, and stay happy. And if you have any questions or queries, I am always open for discussions. You can post it out on this chat or we can talk in person at any given time. I'll be happy to talk to you guys with that. Thank you so much, and I hope you guys stay safe.